It's time for Wise Money with Korhorn Financial Group with certified financial planners Kevin Korhorn, Mike Bernard, and Josh Gregory.
Welcome to another episode of the Wise Money Show with Korhorn Financial Group, where every week we're helping you take your next wise step in your financial life. Thanks for being here, friends. My name is Mike Bernard. I am your host. I'm also one of the CFPs on the program. With me in the KFG studios today, my business partner and fellow CFP, Josh Gregory, and special guest health insurance expert, Ben Bulgrien.
Hey, working past 65 has its benefits, but for a lot of people, it can create confusion as they transition onto Medicare. Today, we'll share the biggest Medicare mistakes you need to avoid when working past age 65. We're going to cover that and more on this episode of The Wise Money Show.
I would say this is one of the top 10 fears people walk in with. Of course, and like this is, I'm sort of lumping at the front. Can I retire? Is the market going to crash? You know, those sorts of fears.
Not
right?
public speaking and death.
Well, yeah, financial fears.
Oh, okay.
But I'm afraid I'm going to make a mistake with Medicare. And it's going to be costly, and we're going to talk about that and help you avoid some mistakes. If you have a question for the program or need some help, we are here for you. Call or text us 574-222-2000. That's 574-222-2000. Online, wisemoneyshow.com is where you can find us. Reach out to us there as well. But then all over social media, wherever you're at, we are there as well. Search The Wise Money Show. So we've got two big social systems that are intended to be sort of the baseline for your retirement. And you guys know them. It's Social Security and Medicare. Here's the thing. At that stage of life, and as crucial as they are, you just want them to be easy to understand, easy to implement. You get it. And unfortunately, the reality is they are terribly nuanced and wildly confusing beyond what you can actually understand. And so, all right, we're going to help you avoid some mistakes, but let's get this one out of the way. Even though they're sort of daisy-chained and part of the same retirement social system, they're actually, you pay into them via the same tax, that four-letter F word, FICA. There's different ages when you're eligible.
Isn't that interesting? And the Medicare rules are the ones that haven't changed over time. You know, I think back on my entire career as a financial advisor, and we've watched things like, what age do I get my full Social Security benefit? That has changed over time, and it's based on what year you were born. So hopefully you're aware, like what age? Is it 66 in a few months for you because you're right on the eve of it? Is it as high as 68 for you as a full retirement age for Social Security? Social Security will let you retire as soon as 62 and start drawing, or as late as age 70. So you've got all these ages for Social Security. And again, the right age for you depends on your situation, but there's a lot of options to choose from. But the one that hasn't changed is Medicare, age 65, right?
Yep, age 65 for the vast majority of people. There are some situations where an individual could get on it sooner than that, and that would be if somebody was on Social Security disability for 24 months or 2 years, or if somebody had end-stage renal disease. Both of those would be situations where it doesn't matter what age you are, you can join Medicare at that point, but for almost the whole population, right? Yep. The majority of people, it is that age 65 mark.
Yeah, That's right. And by the way, those, just a couple color comments here, the Social Security disability, disability, that makes you eligible for Medicare, not Medicare supplements necessarily.
Correct.
So again, as soon as you think it might sound simple, it's more complicated. And then the other thing is, Josh, this full retirement age, we know Social Security is broken. And by the way, go to the Wise Money YouTube channel. Lots of content keeping you updated on that debate. But there is a proposal in a 2025 budgetary forecast to start adjusting those full retirement ages again. There is. You know they're not going to approve it. You know they're going to wait until the very last minute, which is probably 2032, to make a change. But they'll likely be shifting these Social Security ages again at some point over the next decade.
You know, it's such a political topic, though, and the people that will be affected by this are usually younger folks.
Yeah.
You know, for you and me, Mike, it's age 68. But my kid's age, for example, is it going
Like
to be
Ben?
70? Yeah.
Just kidding. Ben's a little younger, yeah.
Is it going to be 70? Is
Right.
it going to be even older? I don't know. But a lot of those people aren't voting right now. They don't have Social Security on their radar. And so it's sort of a safe tweak or change for them. But they've never messed with the age for Medicare.
Not yet. But so here's the thing. Okay, so we've laid out those ages. Working past age 65 can be an enormous benefit, though. So you need to build your 5-factor retirement plan. And those 5 factors are: what age do you plan to retire, and life expectancy. So how long will retirement last? That's the first one. Second is, what are you going to be spending in retirement? That needs to include health insurance. It has to, and a certain inflation rate on health insurance. If you're not doing that, then you're not planning appropriately. So it's got to include taxes and other things as well, but you're spending. Income sources in retirement, that's where you're going to optimize how you draw Social Security and when. That's the third area, income sources in retirement. Fourth is how much you have saved up for retirement and how much you are saving or need to save up. And then lastly, what investment risk and your investment strategy is for those saved up dollars, because really aggressive investment strategy will have one potential risk and return outcome. Very low risk investing will have a very different outcome. Those are the 5 factors. They're all interrelated. Okay. But when you are looking at your plan saying, oh, I'm right on track and I just want to work a little bit longer because I love what I do and I just want to make an impact, and so I want to work until 68 or 70, or you look at your plan and say, well, we want to have this sort of lifestyle, or we have this sort of lifestyle, and in order to afford that, we just need to work a little bit longer, and that's okay. Working past age 65, even though you could get Social Security and you are eligible for Medicare, continuing to work can make a big difference. You just don't want to make a Medicare mistake.
That's right. And I want to emphasize the fact that if you don't know that you're ready for your retirement goal, that extra 1 or 2 years added on to your working years, it does so much for you, because it's an extra 1 or 2 years of saving. It's an extra 1 or 2 years of letting your investments continue to grow and mature. It might be 1 or 2 more years of paying down debt or eliminating some cash flow constraints for you. Might be 1 or 2 years of accumulating more just liquid savings that will help you in retirement as well. It's 1 or 2 more years to delay Social Security, as you were saying, 1 or 2 less years to rely on your nest egg. 1 or 2 years matters a lot. Mm-hmm. But as you're saying, if you sneak past age 65 and you're adding 1 or 2 years into 66, 67, it could set you up for a trap, potentially. Yeah.
So we're going to help you with that. We're going to hit the biggie first, but 1 or 2 years to help you avoid IRMA, right? Like so you've got to be aware of that. We're going to get into it. So we're going to hit 5 common mistakes about Medicare, so that you're aware of them and can avoid them. And guys, this is the biggest, I think. This is the big fear. Medicare mistake number 1, when you work past age 65, that you don't get on Medicare at the right time. And again, I think this is one of those big fears. Mm-hmm. So you don't get on Medicare at the right time, and therefore there's consequences to that. So Ben, how does it work? How much time do you have? Or if you're still working, do you have to get on Medicare at 65? Sure. Or can you delay that? And what are the penalties, all that? I know there's a lot to unpack here.
Yeah. So I'll try not to get into the penalties, because I know that's coming up in one of the future mistakes.
Yep.
The big fear, though, is having a gap in coverage. People don't want to have any time where they had coverage through their employer, and then now they don't have anything. And that's a really big deal, because similar to your employer coverage, there is an enrollment window to sign up for Medicare. And there are multiple enrollment windows, which makes it more fun for us, right?
Yeah.
And so when you first turn 65, or when you turn 65, you have an initial enrollment period, and that's going to be 7 months. And for most people, that's going to be 3 months before your 65th birth month, your 65th birth month, and 3 months afterwards. Mm-hmm. There's a special rule for people that are born on the first of the month, and it shifts a little bit. It's still 7 months, but it's 4 months, and then for before, and then your birth month, and then 2 months afterwards. So you've got that initial enrollment period. Now, if you have group coverage through a employer that has 20 or more employees, then you can delay coverage because they have a qualifying health plan. Mm-hmm. And I always advise people to talk with their benefits administrator, say, hey, let's verify. Let's ask them to say, yep, you've got this proof of coverage, but that's the rule. And you can delay coverage
Past age 65, you're saying.
past age 65.
So you're still working for that employer. They're providing group health insurance for you. So you don't have to, on your 65th birthday or the 3 months before, 3 months after,
Right.
you don't have to go sign up for Medicare in that case.
Correct.
Okay.
Yep. And there are maybe some situations where it makes sense to sign up for a part of Medicare. Or maybe delay other parts.
But that can lead to other traps as well. So so there's more here that I want to get to, because if you work for a smaller employer or if you have a bigger employer, can they force you? So there's more questions here within this first mistake, and then we got to get into those penalties and some of the other issues as well. So a lot more coming up here on the Wise Money Show with Korhorn Financial Group. Hello, YouTube. Thanks for being here. This is the Wise Money Show. What you're watching right now is our weekly 1-hour talk show that airs right here on this channel, 10 a.m. Eastern Time every Saturday morning, also on podcast at the same time, and then also on a couple local radio stations at the same time as well, which is why the content's broken up the way that it is and as long as it is. But if you're into something that's more palatable, shorter, 10 minutes long or so, we have Next Wise Step videos that air right here on this channel every single work day. So 5 of them every single week, taking one financial concept, applying it directly to your financial life. We have probably created 3 or 4 videos about various mistakes with Medicare and signing up for Medicare. Also have talked about these very things before. So make sure that you hit that subscribe button, turn on notifications so you're made aware every time we drop new content. And if you like the content, like the content. And I've had too much caffeine, if you can't tell. I'm talking fairly fast.
Okay, so I thought we would get into the penalties.
I know. I
in
kind
this one.
of want to.
Okay.
And then we'll like mistake number 1 and number 2 overlap.
Right.
They do. So, but I do want to ask, just, and I'm going to prep you on this right now. Can an employer with, say, 50 employees, can they force someone to go on to Medicare? And even if they can't, could someone choose to? And then how does their group coverage play nice with Medicare?
Like which one's primary and which one's secondary?
Yeah. You have those?
So I don't believe that legally they can force you off.
Okay.
And if you were to be on an employer with 20 or more employees and have Medicare, Medicare would be secondary.
Yeah. So I knew that one, but
Yeah.
I'm going to ask you that and we'll get into it. And then, we can get into.
For employers less than 20, is that where Medicare would be primary?
Medicare would be primary.
So
They can be on their plan if they want,
Uh-huh.
but usually for those smaller employers, it makes more sense financially to choose something else.
Get a Medicare supplement as the extra.
Right.
Okay.
Let's hit both of those on the show here, and then we'll get into it. All right, here we go. If you're working past age 65, do you have to get on Medicare right at 65, even if you have group coverage? Or how soon after you finish that group coverage are you forced to get on Medicare before there's a penalty? We're helping with all of that. 5 big Medicare mistakes when working past age 65. That and more right now. This is the Wise Money Show with Korhorn Financial Group. Thanks for being here. My name is Mike Bernard. With me in the KFG studios, Josh Gregory, special guest, health insurance expert Ben Bulgrien. Stay up to date on all Wise Money content. Find us online, wisemoneyshow.com, and then all over social media. Wherever you're at, we are there as well. Search The Wise Money Show. 5 mistakes, Medicare mistakes, when working past age 65. And the first one is, again, one of the biggest fears, and that is, what if I don't get on Medicare at the right time? So you said, and we're going to get into credible coverage. Mistake number 1 and number 2 really do overlap, but they're different. If you're working past age 65, can your employer say you have to go on Medicare because you're costing a lot of money for us to continue to pay for your health insurance, so we're going to force you to get on Medicare?
So I believe that comes back to that 20 full-time equivalent employee mark. If a employer has 20 or more full-time employees, then I don't believe that they can kick you off, right? So you can stay on that plan and you could choose to sign up for Medicare. And if you were to sign up for Medicare, then your employer plan would remain the primary payer. So any hospital bills, any medical bills would come to them first. And then Medicare would be the secondary payer. So anything left over from that hospital bill that went through your insurance would go to Medicare. And then if there was anything left over from that, that would come to you for your responsibility.
So essentially, Medicare helps you to cover your deductible and your
Yeah.
out-of-pocket costs because you've got 2 layers of coverage at
Right.
that point.
Right, exactly.
Okay.
Now, under 20 employees, then your employer coverage, you probably can keep it. I'd say it's always best to verify with your benefits administrator, ask them those questions for double verification. But at that point, employer coverage would become secondary. So there's no choice in that one. It is, you have to be on Medicare, and Medicare would be the primary payer, and then your insurance, if you chose to keep it, would become secondary. So flip the example from previously, you would go to Medicare first. What we find is that typically for some of those smaller employers, at that point, it probably just makes sense to get on a Medicare supplement or a Medicare Advantage plan. Not always, but it's always good to evaluate those options as that time is coming up.
Yeah. Okay. So you mentioned the 7-month window for your initial enrollment period. And then if you keep working, you've got how many days again? So if you were working until say 67 and you've got credible coverage, which we're gonna get to, how many days after you retire do you have to get on?
So after you retire, you would have a couple different windows, which is really fun for us. Is that to get on a drug plan without it facing any type of penalties, you have 63 days.
Right.
For a qualifying health plan to get health coverage, you've got up to 8 months to sign up for that.
So that's where I still just think, well, you're gonna 63 days. You got to get it done right away. If you're outside of that window, then what are the penalties?
So the penalties for that.
Yeah, go ahead.
For those Part D coverage, prescription drug coverage, for every month that you are past that 63-day mark, you get a 1% penalty. And that's not 1% on your plan. So there are some plans that are $0 a month. So, okay, no big deal for 1% of zero. It's on the national average. So 1% every single month, and that penalty will never go away. So by delaying that point, you're going to be paying penalties for the rest of your life.
So 12% a year, essentially, for every year that you went too long or waited too long to get signed up.
Yep, correct. And then for Part B, the medical piece of it, it is a 10% penalty for every 12 months that you don't have it. So you could even miss that 8-month window and potentially not pay if you had a different window to sign up within that 12 months. But as soon as that 12 months hits, it's 10%, and that also never goes away.
And that's 12% a year, and that does break down fractionally by month, right? Doesn't it?
No, I don't believe so for the Part B penalty.
Okay.
Yeah,
All right.
the Part D one is the
monthly one. And it never goes away.
Never goes away.
Yeah.
And there's also not really much of an appeal process on this, is my understanding.
Right.
I mean, you can appeal as long as you discover that you were late within 60 days or whatever, but you're not appealing, oh, I didn't realize, or I was really busy that couple months. It was, no, I think you calculated something wrong, or I think I'm being penalized incorrectly or whatever. So even your ability to appeal on this thing is really limited.
Right.
So, man, getting close to age 65, obviously big decisions that have to be made, and we're always encouraging people to make that with a coach walking with them, right? And that needs to be probably a certified financial planner along with someone who specializes in this type of health insurance. Obviously, Ben, we turn to you and your team often. But then, so that's one window where you've got to get it right. But then if you keep on working, as we've been discussing here, you go past age 65 in your working career and you're getting close to being done, again, it's never really too early to start those conversations with an expert, because you've often warned people of these ahead of time. Make sure that they've got all their ducks in a row. They don't miss any of these deadlines, or just get rushed into making a bad decision.
Yeah, that's a big one.
So
Okay, still embedded in mistake number one, and this is the last thing we hit, and then we'll get to mistake number two. But oftentimes when people think of switching their health insurance, that gives them the hives. Like they just they don't love it. I know how my current plan works. I've been working at this company for a long time, and therefore when I retire, I know I can get Cobra. So I'm just gonna work until 66 or 67, and then I'll do Cobra, and so I can keep all my same stuff, and then I'll get onto Medicare. Huge problem.
Big problem.
Why is that?
So it is the exact same plan. Cobra is the exact same plan that you have previously had, but it does not, in most cases, it does not count as a qualifying health plan. And so then when you've got that plan and you think, oh, well, I've got my coverage, I had the same coverage I had previously, at least for the health portion of it, Well, that might be a mistake. You might be racking up those months of time without having that qualifying health plan that could count towards that penalty.
Isn't that insane? Like, you'd want to just look and say, well, no, I'm going to make this decision based on the cost. So what's the cost of COBRA versus the cost of Medicare? And yet it's not, because Medicare, COBRA, the same health plan, technically isn't a qualifying health plan.
Right.
And this takes us right into mistake number 2. Mistake number 2 is working past age 65, but not having creditable coverage. And that is, well, I've got, and this could be, and I'm just going to throw a couple scenarios out there. I'm going to work past 65, but I don't have group health insurance. I'm on a share plan, or I'm working past age 65, and my employer hasn't given me this document saying my prescription plan is creditable or something like that. And in this case, COBRA is really not creditable coverage. Is that essentially what we're saying? And
the crazier part about it is that the health plan, in most cases, is not. The Part D coverage, it could be.
Oh, my goodness.
It could be considered coverage. So you wouldn't face penalties for the drugs, but maybe for the health coverage.
Okay, so go ahead.
Well, I was just going to say, kind of clarifying this in my own mind, and maybe for those that are listening, the whole idea here is that Medicare wants you to not just be showing up at age 65 or some other date and signing up for this health insurance for the very first time. You know, you don't go your whole working career without health insurance and then jump on Medicare.
Right.
You have to go from a good plan, a creditable coverage type of plan, onto Medicare, and you said it's got to happen within 8 months.
Right.
So the trap here for someone would be that they go from a group health insurance plan that's always worked for them, they've loved it, onto either COBRA or nothing at all. And when they go past 8 months and try to go on Medicare at that point,
right,
that's where we get into another penalty situation.
Yeah, there's also specific windows that people who work past 65 would need to operate within. So that 8-month window after retirement, that would allow them to sign up for Medicare Part A and B. If you miss that, then there's a general enrollment period each spring between January 1st and March 31st. So if you, for some reason, miss that window, then you would still have the ability to sign up for Medicare coverage later on. But that's where, depending on how long it's been, you may face penalties. You probably have, or you definitely would have some type of gap in coverage. And so that would just be another thing to plan around to make sure that you've got no gaps in coverage.
I'm going to go back to where we started, and we're only 2 mistakes in. This is wildly confusing. You're not going to remember all of these, and there's not enough flyers that you can get in the mail, and I know you're getting bombarded right now, that will sort this out. This is a who, not how. And I know we're still going to break down some more of the mistakes, but who is your guide? Who is your guide that's helping you? You need the right expert, the right team to help you navigate this for your situation so you don't make a Medicare mistake. We've got more Medicare mistakes to point out and warn you of. That more coming up on the Wise Money Show with Korhorn Financial Group.
It's pretty obvious that these rules have evolved over the years, and there's just kind of layers of sediment that have been built up. It's not like it was coordinated with, again, the penalties don't line up, the open windows don't line up, timeframes, all of that. Man.
And up until last year, if you signed up for your Part A and Part B during the general enrollment period, your coverage wouldn't start until the middle of the year. So if you signed up January 1st, then your coverage wouldn't start until June 1st.
Why?
I have no idea. Yeah, it was interesting.
Okay, so there's one other point we haven't hit with these, and I probably should have brought it up in the first one, and that is, don't I need to know when my coverage is done? Like, if I retire on the 2nd of the month, is my coverage done on the 2nd? My group coverage? Yeah. And so let's hit that, because there's 2 ways.
Does it go through the end of the month?
Right. And then we'll get into the mistakes 3 and 4, because they're HSA related, and then mistake 5. So, all right, third segment. Do you have a high deductible health plan, an HSA qualifying high deductible health plan? If you do, couple of traps, couple of huge mistakes that you could make when transitioning onto Medicare. We're going to help you avoid those right now. This is the Wise Money Show with Korhorn Financial Group. Thanks for being here. My name is Mike Bernard. With me in the KFG studios, Josh Gregory, and special guest, health insurance expert Ben Bulgrien. Every episode of the Wise Money Show, as well as a lot of other content, it's on the YouTube channel. Go check it out. Go to YouTube, search the Wise Money Show. Subscribe to it there. Turn on notifications here and there every time we drop new content, which is all the time. And well over 1,000 videos there. And you can leave questions, comments there as well, and share the program there. We appreciate that. All right, so we're into Medicare mistakes that you can make if you're working past age 65. Not a lot of people do. It can make an enormous impact in your retirement plan. And I think as we're all living longer, and as the finance world and all of that gets and remains very complicated, I think more and more people will be working past age 65. Especially, we'll wait and see what they do with Social Security ages. If they push that back, I think more and more people will continue to work past age 65. You got to avoid some big Medicare mistakes. We've hit the first two, and embedded in those two is another question we get a lot of times, and that is, well, but when I get off of my group plan, when does that group coverage end? Right? I need to make sure I get Medicare in place before there's a penalty, but you really don't want to have a gap in coverage at all.
Right.
Even if you're within that 8-month window or 7-month window or 63-day window, you really don't want a gap in coverage because you could slip and fall. You could have an issue. Yeah. So how do you know when your group coverage is going to end?
Yeah, the piece that I always start with is I know for a fact your Medicare is going to start on the first of a month. And that's either the month that you're done working or the month following the month that you're done working. And so it is best to verify with your employer, ask your benefits administrator, hey, when is my coverage going to end? Typically what we find, it ends at the end of the month. But there are some situations where somebody has said, oh, no, my last day is on the 2nd, and so my coverage is done on the 2nd.
Yeah.
And so we'd want to make sure in that situation that we have your Medicare on the 1st of that month, because otherwise we're going the remainder of that month without any coverage whatsoever.
I would say there isn't a most common practice by employers. Your options are, as an employer, when you're setting up your health insurance, the coverage is going to end the date of termination or the end of the month in which the employee terminates. And I don't think there's a normal choice. I think it's 50-50. So anyway, work with the right team, specialists and all that, because you want to have your Medicare start so that there isn't a gap in coverage. Yeah. All right, mistake number 3. Actually, mistake 3 and 4 deal with the same thing, and this is the more common. I mean, we don't love them because they're higher deductibles. We love them because of the flexibility and tax benefits that you get. But when you have an HSA eligible high deductible health plan. So mistake number 3, and these are nuanced, but they're different. These are different mistakes. Mistake number 3, when working past age 65, is getting on Medicare Part A and then still contributing to your HSA through work. So this is the scenario here is, okay, I turned 65. Might as well get on Medicare Part A. I can. Right. Doesn't hurt.
No premium.
No premium. Right. So I'll just get on that. But then I've got my group coverage, so I can keep contributing to my HSA. Right? Wrong. Well, you can.
Sure.
You can. There's just a penalty. You're technically not allowed to. And why is that, Josh, Ben? Why is that?
Go ahead. It's because you're not allowed, right? It's ultimately one of the rules here is that you can't be contributing to an HSA and be on Medicare of any type at the same time.
Well,
right?
I think technically how it's written is, in order to contribute and deduct your HSA contributions, you have to have a qualifying high deductible health plan, but you can't have any other coverage.
Right.
And the reason why they put this rule in there is if you're married and both spouses have unbelievable benefits, in which case that it's free to have a dependent on, which, maybe that existed in the 80s. It does not exist right now. And so if it's free and one health insurance plan pays first dollar, has a very low deductible, and the other one has a high deductible, well, then let's do both, because we'll get a really low deductible. Health insurance will kick in right away, but we're also eligible to get a big tax deduction. They say, no. Sure. Right. So here's the thing. Yeah, Medicare Part A is free for most people, or you've already paid into it. Yep. So you've got the trap here is, well, I guess I'll just sign up even though I don't need it. Right. And that means you now have other insurance. That's right. And you can't.
And they will let you sign up. That's
Yeah.
fine. It just it no longer allows you to be contributing to that health savings account is the key. And the real gotcha on this is that when you sign up for Medicare Part A, they look backwards. Is it 6 months?
6 months if you've worked past 65.
Uh-huh.
So it wouldn't go to 64 in 6 months. It would just be, if you work to 65 in a month, it would actually, your Part A would start on your 65th birth month.
So that's where these two mistakes do overlap. I want to camp out on number 3 for just another moment, because here's another common scenario. I'm working and I have group coverage, but I want to draw my Social Security right at 65. And if that's before your full retirement age, then you've got to be aware of how much are you earning and how much, so your Social Security doesn't get penalized. But there are a lot of people who say, I want to work, I want to double dip, I want to work, and I want to draw my Social Security. Well, if you're drawing your Social Security, you are automatically enrolled in Part A.
Yep.
So you might have heard mistake number 3 of working past 65 and getting onto Part A while still contributing to an HSA, and you might just say, I'm not going to do that. I just will not do it. No. If you're on Social Security, you don't have to not do anything. Like it's going to happen,
right?
Like, so you would have to opt out, and that gets very, very messy, and seeing a lot of mistakes there. So, yeah. All right. So Josh, you took us right there. Mistake number 4 is, all right, you were aware of that Part A trap. You avoided that one, but you're working past age 65 and you just continue to max out your HSA, contribute as much as you can, right up until you get on Medicare. Don't ask me why. I don't have a lot of time to just sit around with the kids and all their sports. Don't have a lot of free time in the evenings. But I watched an episode of Seinfeld last night. It was pretty funny. It's a hilarious show, by the way. And it wouldn't work in 2020s. It just wouldn't.
Right.
But Kramer was talking about how I can't remember what the initial joke was, but Kramer was like, well, before surgery, you have to eat something because you got to eat while you can because you need your energy. And Jerry's like, no, you can't eat before surgery. I think it was Jerry was going to the dentist and Kramer was like, oh, make sure you don't eat before you go to the dentist. And he's like, no, you can eat before you go to the dentist. He's like, no, they're going to clean your teeth. You can't eat for a day. He's like, no, that's before surgery. He's like, no, you need to eat before surgery. So anyway, but here's why I bring that up. Because it's like, well, I'm about to go on Medicare and I can't fund my HSA then. So I've got to fund it now. I'm about to lose it. I've got to fund my HSA right now. And that would be true. But there's a gotcha. What is that gotcha? Josh, you already started mentioning it. This is a 6-month rule, but let's explain it even more.
Well, I thought what you were going to lead into is don't eat the day you're going to sign up for Medicare.
Oh, there you go. Because you might get sick.
Full stomach.
Yeah, you might get sick.
You might have something in your teeth.
Yeah, so the gotcha moment is that there is a Part A 6-month look back. And so if you're working to age 70 and it's January 1st and you say, okay, I'd like, or December 31st, I'd like to retire so I don't have, I've got Medicare starting on January 1st. Your Part B will start on January 1st. That's not a problem. Your Part A will start 6 months prior to that. And so all that year that you've been contributing to your HSA, for half of that year, you shouldn't have been able to put those dollars in.
Yeah.
And it gets real messy if that 6-month window spans the end of a calendar year, start of a new one, because now we're dealing with 2 different tax years as well. And if this, if you over contributed to the HSA, it's not the end of the world. You can get those dollars back out as long as you catch it in time. Otherwise, you may have to be pulling money out and amending tax returns because you discover it too late. And unfortunately, this really is a major trap for a lot of people because of what you were very humorously pointing to. People love contributing to their HSA. When they're getting close to the edge of retirement, it's like, okay, I'm running out of time. I've only got a little bit more that I'm allowed to contribute. And everybody wants to get that last dollar into the HSA. They might not realize that last dollar actually happened 6 months earlier.
And this is, again, every show we're going to tell you got to work with your certified financial planner. Why is that important here? Because someone that's just looking at your investments or saying they're going to help you with retirement, even though they're just looking at investments, they might hold themselves out as a financial planner. You might think they're a financial planner. They probably don't understand this rule. So they're probably going to say, oh, yeah, fund your HSA all the way. And meanwhile, you're going to have a penalty. So what are the other mistakes? We've got that and more coming up on the Wise Money Show with Korhorn Financial Group. All right, that's 3?
Yes.
All right. Okay, because we haven't hit the employer contribution. And I've got a story as well, and that just helps with this sort of stuff too. So we're running out of battery here. All right, so we're good. One more segment. Land on plane. We're good on time. Do you have any other mistakes outside of these top 5 that you see, or common questions as people are working past age 65? Common questions that people have. My spouse has coverage. I'm on group insurance, but I'm not the primary. Can I stay on? We can hit that one.
One question. I don't mean to cut you off.
No, you're fine. Yeah.
Clients want to know, well, when do I need to be sitting in your office to talk about this stuff?
Yeah.
How far in advance of my retirement date is a safe amount to begin investigating and stuff?
So we've got a couple of those questions we can, because I don't think this last one will take the full segment. And so, although it could, Irma's hard to explain. So
This is also HSA dollars. What can I spend them on in retirement?
In retirement. Yeah, great. That's a good one. All right, here we go. So 4 segment, land on the plane. We got to hit the rest of mistake 4 and number 5, and then we've got a couple of the questions we could get into. Thanks for being here. This is the Wise Money Show with Korhorn Financial Group. My name is Mike Bernard. Here with me in the KFG studios, Josh Gregory and special guest Ben Bulgrien. Every episode of the Wise Money Show is on podcast. Wherever you listen to podcasts, go check it out. Search the Wise Money Show. Subscribe to it there or follow us there. Rate the program there as well. We appreciate that feedback. We're talking about Medicare mistakes if you work past age 65. We're hitting the top 5 of them. The 4th one has to do with having an HSA and funding it right up until you retire and join Medicare. If you are working past age 65 and keep that group insurance, then when you enroll in Medicare, your Part B will start at the beginning of the month, but your Part A will retroactively start 6 months or go back to 65 or 6 month, whichever is shorter, right? So here's the scenario. Have a situation where an individual is retiring at the end of the year. That's their plan, is to retire at the end of the year this year. Turns 65 in the spring. And also says, well, by the summer, we've got plans. And you know what? If I'm not enjoying work, I might retire on July 1st. And so it's like, how do we fund the HSA in this scenario? And so I've had to explain these rules multiple times through email and in person because it is so confusing. And it's like, okay, well, we're going to fund your HSA per paycheck with the plan of maxing it out. But be aware that we're going to have to stop contributing by June 30th, either way, because this backdating, if you start Medicare January 1st, it's going to backdate to 6 months.
Yep.
But if you happen to be done in July 1st or August 1st, we're going to have to pull out your contributions going back to the time you were 65, which was in the spring.
Yep.
You're nodding along because that did make sense. But to anyone else listening, that made no sense. So again, work with the right guide. Here's the other unique thing about this very story, and we were talking about this before we got on the air. Their employer contributes to their HSA. So this 4th mistake gets even more difficult if you receive this fantastic benefit where your employer contributes. Talk about that, Ben.
Yeah, so it is the same rules for the employer contribution. The tricky part, the especially tricky part about it is when it gets into, hey, my employer is going to contribute a chunk on January 1st. And so if you were to sign up in one of the early months of the year, March, and you've already filed your taxes, but then you sign up for Part A, and then it backdate to the previous year, well, then you'd have some dollars that you potentially shouldn't have contributed in the previous year. You got the employer contribution for the current year, and then now we need to look at withdrawing some of those funds for next year. It's not unplannable. It's just kind of a headache to go around and make those corrections.
Yeah.
So what do you recommend in a situation like that? Does someone not only need to be in your office talking to you about their upcoming retirement, do they need to be kind of coordinating with their employer so that the employer doesn't, throw money into the HSA unnecessarily or unallowed, I guess I should say?
Yeah, it's the most recent example I have with this is they said, hey, even if we choose, we know that we're coming on to Medicare in April. We know that we're not going to contribute anything, but we're on the plan still. The employer is going to contribute that amount, no matter what they do.
Yeah.
And so that to plan around towards the end of the year, talking with them, that their decision was, we're just not going to mess with it. we're going to sign up for Part A, even if we keep working, just to avoid those things that we need to pay extra special attention to. We'd rather just
trying to simplify life a little bit. Yep.
And I would say work with an advisor, and they'll help you manage that complexity so you still get all the tax benefits. In the year that you are unable to contribute to an HSA, like that annual maximum contribution, which for an individual this year for 2024 is $4,150. Plus $1,000 if you're age 55 or older, which you would be in this scenario. We're talking about 65 and older. Family is $8,300 plus $1,000 for technically each of you, each spouse if you're over age 55. It turns into a pro rata. So that's the annual, or that's the 12-month. So go back and work on your fractions from elementary school or whenever, and figure out, well, how many months are you eligible to contribute to an HSA? Take that fraction, apply it to that annual limit, and that's the amount that you're able to contribute. So, all right, last big mistake, and that is not managing your income. So last Medicare mistake when you're working past age 65 is not being aware of or planning for your income, and in a surprise, being subject to income-related monthly adjustment amount, or IRMA. Now, the reason why I'm saying not being aware and not planning for is, listen, you might have a financial situation where there's going to be no way for you to avoid it. And I would say, while that's possible, that's not likely. Many people are paying IRMA when they could have just planned through it and planned better. What is IRMA? What does that mean? Josh, do you have those limits right there?
I do. Yeah. Okay. And, it's basically a changing threshold every single year where if your income crosses these certain numbers, gets too high, so to speak, then the government is essentially going to start charging you more for your Medicare Part B premiums and your Medicare Part D premiums. And it's not an inconsequential amount either. For each spouse, when you go from basically having your Part B be at the minimum level to jumping into the next tier, I mean, it could be $100 a month more for you and your spouse for that entire year. And it's all based on your adjusted gross income, which is it's your modified adjusted gross income. It's a special number on your tax return. But just basically add up all of your different sources of income that are counted on the tax return, and if it goes over $206,000, then all of a sudden your premiums are jumping up to $244 per person. If it goes to $258, so not a wide band there,
right?
Now all of a sudden you're at $349, another $100 increase. And it can keep on going up from there. You could end up paying as much as the most that anybody would pay for Medicare Part B is $594. And this is all based on the income that you logged on your tax return 2 years prior.
Prior year.
That's right.
So it's so why? Because that's most likely your most recent completed tax return. But for you, so there is logic. But for you, that feels like forever ago.
Yeah.
If you like, I have no idea. How much did I earn? How much was my adjusted gross income a couple years ago? Why did we tie this one to a mistake for you working past age 65? Because it's not unique to you working past age 65. IRMA is IRMA is IRMA. So if you sell a property, if you sell a stock, if you want to take, we talked about this in the last episode. If you want to pay off your $100,000 mortgage and you take then $160,000 out of your IRA and you withhold taxes to get you the $100,000, well, that $160 is going to land on your tax return. It's going to count to this calculation. Why is this unique to you working past age 65? because you're working past age 65. You have income past age 65. If you retire at age 62, well, then your income is going to stop. Your wages are going to stop well before you get on Medicare at 65. That prior year rule, you're not at risk. But if you're working past age 65, you will have more income sources that you need to be aware of and track for that prior year. So avoid it if you can. How do you do so? We've done lots of shows and episodes on that. Proactive tax planning, getting more dollars into Roth, being conscious of, well, should I draw more money out of my IRA or from a joint account, from cash? Should I deplete cash? How much should I, is this the year to buy the new car, or should I delay it until next year? And so just proactive planning there.
But keep in mind, why do we say a proactive tax projection? Because that is the mechanism, or that's the tool that you use to run an estimate of where is your income going to land. It tells you what threshold you might be hitting. But if you don't have these IRMA rates on your radar, you could just be looking at the tax return and saying, okay, I like where I'm going to land on my income. I like how much of a tax bite the government's going to take compared to what it could be. I'll just charge forward, and you're not paying attention to the fact that that tax projection is having an insurance impact on you. Mm-hmm. So this is like, this isn't going to show up anywhere on a tax return or even in the projection. It's the person who's guiding you has to be multidisciplinary in their approach to financial planning. You can't just look at this through a tax lens, even though the tax lens is the one that will reveal there might be a problem brewing on the insurance side.
That's exactly right. And so again, we're gonna finish with where we should start, and that is you need the right guide. You need a comprehensive financial planning approach, and your CFP needs to be working with the right health insurance team that will help you avoid all of these mistakes and more. That's all the time we have for today. On behalf of Josh Gregory, Ben Bulgrien, all of us at KFG, have a great weekend. We'll see you next Saturday for the Wise Money Show with Korhorn Financial Group.
Securities offered through Silver Oak Securities, member FINRA/SIPC. Advisory services offered through KFG Wealth Management, LLC. Doing business as Korhorn Financial Group. KFG Wealth Management, LLC and Silver Oak Securities Incorporated companies are unaffiliated.